So the next bill on the agenda is House File 1686. Representative Hollins, welcome to the committee. I will move that House File 1686 be re-referred to the Children and Families Committee. With that, please introduce your bill and proceed.
Thank you, Chair Noor, and thank you, committee members. It is really an honor to be here today to present House File 1686. This bill is a result of collaboration with over 60 public, private, and nonprofit partners who align their work to ensure that homelessness in Ramsey County is rare, brief, and non-recurring. For those members who were in Prevention of Homelessness Committee last biennium, you'll remember Ramsey County being held up as a model of how to address homelessness, and this is a continuation of that model. The collaborative approach and alignment is essential to addressing the unique needs in our community, and the support of this bill of $75 million for use over a 5-year gap will help achieve a more sustainable and effective system that will reduce the need for ongoing investment over time. The funding will be used to provide shelter and services to families, single adults, youth, and individuals with complex needs. It will also help expand and create new or enhanced adult and family overnight shelter, day shelter support, and outreach and infrastructure to move more people into a path of permanent housing. This investment is needed to bridge the gap from the end of the COVID funds utilized by Ramsey County and the City of St. Paul to the completion of new affordable housing. The leadership of our local leaders is nothing short of remarkable, and I am so pleased to have the chair and vice chair of Heading Home Ramsey, Deputy Mayor of St. Paul, Jamie Tincher, and my very own County Commissioner and Ramsey County Board Chair, Trista Matas-Castillo, here to share more about our local story and the importance of the legislature's support this session.
Madam Chair, Commissioner, welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Thank you, Mr. Chair. Hello, committee members. I'm Trista Matas-Castillo. I'm the chair of the Ramsey County Board of Commissioners and the vice chair of the Heading Home Ramsey Continuum of Care. Heading Home Ramsey Continuum of Care is an organization that represents our entire community. It is not just Ramsey County, but the 19 nonprofits and community partners that also participate in Heading Home Ramsey. And I'm really excited to be here with other homeless warriors here today who have really addressed the needs of their community. I think it's important to remember that each community is slightly different, and we've approached the issues of homelessness individually and uniquely. And in Ramsey County, we took a slightly different approach than in Hennepin because it fit the needs of our population here. We currently have a gap of about 15,000 units of housing that are at the 30% AMI level. So very low income families, we don't have enough affordable housing in Ramsey County. And that we have about 2,600 people currently on the waiting list at coordinated entry. So the need is really high. This is something that we take very seriously. And together, and because we're kind of answering some of the questions that were asked earlier right up front, and I appreciate questions, is that we, together with the City of St. Paul, Ramsey County, invested $74 million of our CARES and ARPA money into affordable housing so that we can immediately go to take care of those tails. We want to make sure people actually get to housing. But in the meantime, we have to shelter people where they're at and appropriately, and so that's why we are here today. As you know, the housing crisis continues to grow for lots of reasons. Homelessness is on the rise, and we certainly see it here in Ramsey County. You all have these slides. You can read them. I'm not going to go through every slide because I want to get to your questions, which are really critical, and respect your time as well. In Ramsey County, we have a very diverse population. I think some really important factors about Ramsey County is we're the smallest county in the state of Minnesota, and we have the most concentrated poverty in the state of Minnesota. We're the 10th densest county in the entire United States. So if you think about our size and population, our only means and asset to raise money in Ramsey County to invest in these programs is property taxes, and less than 50% of our land is even taxable because we house all of you here at the state capitol and all of the other services and programs. So we have a unique situation here in Ramsey County, and yet we're also the second largest in population needing to meet the needs. During the pandemic, we were able, because we had an inflection of ARP dollars, to invest in shelter differently than we had in the past, which was unique that we were also able, because of the pandemic, to change our model. So we went from the lottery system, wait for a shelter, hope you get a bed or a mat tonight, to having rooms with doors, with 24-hour security, with wraparound services for individuals. And what we saw is that the outcome of people being stabilized 24 hours a day and culturally appropriate and specific to their needs is the increase in success rate went from about a 3% success rate if you're stuck in the shelter system and constantly looking for where you're going to sleep tonight and access to programs, to a 66% success rate to permanent housing in just an 18-month period. As you saw, we also had encampments during the pandemic. We had the highest number of people sleeping outside in Ramsey County than we have ever seen. At one point, it was 485 folks sleeping outside, and I can tell you that myself and Deputy Mayor, who is not able to be here today because of a family emergency, were out in those encampments and made sure that every person received the care they needed that was specific to them, and to make sure we could bring them inside and then create long-term stability. This change in the model that we know works came with a larger cost up front. So we have already, as I mentioned, we went upstream, we've invested in the money for permanent solutions, but this upfront cost is what we're asking for. We are asking for $75 million. That's $14.5 million a year that we are planning that we can meet the needs to where the county and our other partners can continue to sustain the rare, brief, and non-reoccurring situations of homelessness. But we have this bubble that has kind of occurred, and we have a population that needs to be housed and sheltered appropriately. So that's what this ask is for, and as we move upstream to address affordable housing. I just want to share, invite Randy Roth, who is one of our community partners and a member of our Heading Home Ramsey Continuum of Care, to share part of how that model changed and the outcomes for her families. Randy Roth from Interfaith Action, St. Paul.
Thank you very much.
Ms. Roth, welcome to the committee. Please introduce yourself for the record and proceed.
Thank you, Mr. Chair. My name is Randy Roth, R-O-T-H, and I serve as the Executive Director of Interfaith Action of Greater St. Paul, which houses Project Home, the shelter I'll talk about. Thank you very much. Mr. Chair, members of the committee, let's take a close look at one of the shelters whose fate is tied to this bill. For roughly 20 years before COVID, Interfaith Action's Project Home provided shelter to families with children in Ramsey County. 54% of our guests are under the age of 13. We provided shelter before COVID by rotating through houses of worship. 2 churches or synagogues at a time would host 20 beds of shelter each, 40 beds total for that month. And then on the first day of the next month, we would drive our vans up with the cots to set up at the next church. It all worked fine. In some of the churches, the family could have a classroom. In some of the churches, the families all slept on one church basement floor with cardboard dividers. But we made it work. But then COVID hit. The governor issued an order closing all houses of worship, and we had 40 people sleeping over that night. So in the hours, weeks, and months that followed, we tried many different solutions. With tremendous and courageous help from both Ramsey County's leadership and from the Sisters of St. Joseph of Carondelet, we ended up in a situation that turned out by data, which I'll share in a moment, to be much better for the families and children than what we had been doing before. After participating in the most well-attended Ramsey County town hall meetings ever, and after having the newspaper headline be "YIMBY, yes in my backyard," we were able to move into the provincial house, which had been the former convent of the Sisters of St. Joseph of Carondelet, adjacent to the St. Kate's campus. So here we are, moving shelter into a beautiful high-income neighborhood. Who does that? And it's working. I'd love to take any of you on a tour. We have 100 real beds of shelter in private rooms for families with doors that lock. The sense of peace and safety is palpable. It's well-maintained, clean, sunny, filled with artwork. Every floor has a sunroom where the kids can do homework. We have a computer lab on the 4th floor where the families apply for jobs. And here's the key to our success. As soon as the families move in, we help them focus not just on their stability in shelter, but on their family's economic mobility. Our rapid exit social work team helps them figure out how to achieve their goals for better jobs, housing, transportation, childcare, and more. Here's a few key statistics about how much better it is now that we're in a building rather than on the basement floor. Our average length of stay, a key metric, decreased from 84 days to 66, making room for many more families in a year. We follow our families for 6 months after they move into their housing, and although the data is not perfect, 96% say their new arrangement is working at the 6-month mark. With 100 beds and 30-plus families at a time, we are within striking distance of eliminating the Ramsey County shelter wait list for families, not for singles, but for families with children. With no significant revolving door. The same families are not coming through over and over again. I'd like to take one more minute, if I can, to tell you the story of one family. Are you good? Great. Shauna, a 44-year-old mother of 2 teenagers, was diagnosed with brain cancer. Her mother, Rita, moved in with Shauna and the 2 children to help care for the family. Shauna went through radiation, chemo, several surgeries. She lost her job, and as a single mom with low income, she went through what savings she had in the months that followed. And in November 2021, the grandma, the ma, and the 2 kids lost their apartment and became homeless. They were placed in Project Home. Shauna's brain tumor came back while they were at Project Home, and she had another surgery and more chemo. But in that time, our rapid exit case management team and family advocate staff helped Shauna apply for and obtain Social Security disability and personal care attendance services. Our staff also helped Kira, Shauna's 19-year-old daughter, get a good job in her chosen field, a job that would pay for her to get further training to make more money. And our staff helped Marcelo, Shauna's 15-year-old, to thrive in high school with the stability of shelter, with daily meals, snacks, free laundry, on-site tutoring 4 nights a week. His attendance and grades improved in school dramatically. The family got an emergency housing voucher. Our staff helped the family find a landlord willing to take that voucher. We helped them move in, and they've been in their new home since October and are doing well. I'll point the committee members, please, to the support letters in our packet, and thank you so much for your time and the opportunity to testify.
Thank you so much for your testimony. With that, member discussions. Representative Gilman.
Thank you. This is a much different picture than our last situation. I'm just curious, with the rapid exit team, how did you? Do you mind me asking how you, Chair, how they came up with that process, and do you collaborate, with other metro cities, something like that, and helping support, looking at individuals uniquely, if it's mental health, substance abuse. There's so many things that are available, even through Zoom, AA, Al-Anon, just NA program, just different things that people can find support with what maybe could lead
Ms.
to.
Roth.
Mr. Chair, Representative Gilman?
Yep.
Yep, thank you so much for the question. Our entire agency focuses on first stability and then economic mobility. And it's based on national models that have been launched in the Deep South through the Annie E. Casey Foundation and the Kresge Foundation. And we're doing this both within Project Home and within our Department of Indian Work, which serves the entire East Metro. So you have to be stabilized first, but then we bring in every kind of wraparound service that we see that the families need.
And so just one follow-up question. Thank you, Chair. And thank you so much. Have you gone back to then your synagogues and your churches as well as faith-based folks? Like, I'm encouraging people back in my community, how can we get involved, and it's not just coming to the state and the taxpayer dollars, it's really coming back to our roots and our communities and how we can step up to the plate. So I'm just wondering if you've gone back to church support, and what does that, or synagogue support, and what does that look like?
Ms. Roth.
Mr. Chair, Representative Gilman, yes, thanks so much for the question. We have a full-time Presbyterian minister who's our Director of Congregational Engagement, and every day he's meeting with churches and synagogues and mosques to try to get them to engage more deeply. So we have houses of worship doing the weekend meals, so we don't have to pay staff to do that. And we have houses of worship doing diaper drives and helping in every way they can, tutoring, other services with the kids. It's just that we learned that by the families having a stable site to sleep over at, that was really helping.
Lead New Brindley.
Thank you, Mr. Chair. And thank you for the presentation and Representative Hollins for the bill. I do have a couple of questions. One, I just want to say, you didn't go into this a lot in the presentation, but we heard a lot about this over the past few years. And I will say I've been very impressed with Ramsey County and the city of St. Paul and the approach. And they've done a really, really good job of funneling people into an appropriate lane. And I understand that there are still some problems with, there's a very small number of people for whom it's difficult to find an appropriate lane. And so I'm wondering if you can tell us a little bit, in the bill language, it talks about developing and operating a familiar faces pilot program, and it seemed like maybe that was what that's addressing, and I wonder if you can talk to us a little bit about what that might look like.
Commissioner Mastas-Castillo.
Yes, thank you, Mr. Chair and Representative New Brindley. The Familiar Faces program is specifically to what you mentioned. There's a group of people that are our highest users of other services like police, fire, EMS that are very expensive and maybe not the right response, but when we have someone in a mental health crisis or other issue, they're hard to respond. So this is, and they tend to be the same people over and over. They're familiar faces to us and those of us who are on the ground. And so this pilot would be the creation of specific spaces for them that we can do intensive wraparound services and put them in a right place. There are people that don't fit into other shelter spaces because they're disruptive to the people there. And so we need to have a space specifically for them, and that's what that would be for.
Lead New Brindley.
Thank you, Mr. Chair, and thank you for that. So so am I hearing that this would be an actual facility or a day facility? What?
It could be a combination of both.
Commissioner.
Thank you, Mr. Chair, Representative New Brindley. It could be a combination of both. So it would be addressing to those individual needs. Some of them might be able to get a single room occupancy that just has more care. They might be able to get other services. Some might require, maybe we have a small facility that we can put a few in, but it would be addressed specifically to those needs, which is why it would be a pilot at this time, so that we can learn and grow and develop what would be appropriate.
Lead New Brindley.
Thank you, Mr. Chair, and thank you for that. And my last question would be to Representative Hollins. Again, I have had really good things to say about this program in the past, and I really do give a lot of kudos to Ramsey County and the city of St. Paul, because I think they have put in some intensive work to figure out how to do this right. And they've clearly shown success. And I would also say, interestingly, the presentation you gave also seem to paint a realistic picture, which I appreciate. I'm skeptical sometimes of data that we get, and this felt accurate, and I appreciate that. My question is two-part, all about the funding. So this is funding for 23, funding for 24, and I appreciate that. I think that is a good, positive thing, and used over 5 years. So I think you said it's about $14 million per year. Is your intention with that then is that you'd have this funding over that 5-year period, and that you'd get some things figured out in that time, or it's just up to the next legislature then to figure out additional funding at that point? That would be part A of my question. And part B would be on line 2.1, it says Ramsey County may use up to 10% for administrative expenses. I'm a little bit concerned that that amounts to 7.4 million. And that's grant administration. These are grant programs. That seems very, very high for administrative costs in a relatively short period of time. I can't imagine that they are going to require that much staff time to administer these programs. And so I'm hoping, Representative Hollins, that you might consider maybe a smaller percentage there moving forward, just to make sure that this money is going where we actually want it to go to. So those would be my questions, but overall, I think this is great.
Representative Hollins, those are 2 questions.
Thank you, Chair North. Thank you, Representative New Brindley. I barely remember the first question at this point, but I can say the second question, I am willing to discuss and negotiate on how much the administrative cost is. We know that it is a slightly higher administrative cost than you would normally see, like that 2.5% to 5%, just because some of these programs are going to be new and they are very administrative heavy. But I think we're willing to talk about that. And for the first question, I think, yeah, the commissioner would like to answer.
Yes, Mr. Chair, thank you, Representative New Brindley. You had the first question, you kind of answered it in your question. Our plan is, because we have gone upstream to invest in affordable housing, to get that number of units online, we need about 5 years. And which is why we've really calculated and planned that out thoughtfully, is that's how long it's going to take to bring enough units online to be able to stabilize. I'm not saying we're going to end homelessness in Ramsey County, because it is a situation that people experience at different times, but that it would put us back into a level that we can go back to our system of the county with our community partners, being able to stabilize the capacity at that time. I think it's important to remember too, as I mentioned, we kind of have this bubble right now. Less than 42% of people that we are currently serving in our shelter program actually identify as Ramsey County residents. They come from all over the state of Minnesota for services, and there has been a long time fight about sending people back to different places. But they're in so much trauma and crisis in that situation that we took the approach of, let's serve people on behalf of the entire state of Minnesota who are here right now and stabilize them as a part of the greater good. So I just wanted to mention that as well.
Thank you, Mr. Chair. Great use of one-time money.
Thank you.
We have 2 more individuals, and then we will 2 members, and then we'll go to vote. Representative Zeleznik.
Thank you, Chair Noor, and thank you, Representative Hollins. I, too, want to say thank you. What I was really impressed with is the housing piece of the stability of housing. We all know is obvious, but what I liked hearing is the economic mobility. That's the thing I'm looking to hear, is how are we doing pathways to, not to further advance people to their furthest potential, and to be a part with those wraparound services and how they're working together. That to me is the thing, because then the person's moving out of that model into a productive place to society for their own self-confidence, own self-esteem, their own personal goals, and then that bed becomes used for somebody else that is in that place. And it becomes not a lifestyle, but a short-term transition model into a pathway. And I love what you're doing with that, so congratulations, and look forward to seeing what it does. Thanks.
Thank you for your comment. And the last person on the list is Representative Franson. Just a quick comment.
Actually, it's not a quick comment, so I'll just take it offline with Ramsey County. Thank you.
That will be great. So with that,
It's your birthday gift here.
Happy birthday,
it's Thursday afternoon. So with that, your closing remarks, Representative Hollins.
I know thank you, Mr. Chair, and thank you, committee members, for the conversation and the discussion. And I'm happy to continue having those conversations with folks. The one thing I really wanted to recognize and address is that what I'm really proud about from Ramsey County and a St. Paul perspective is how our elected officials aren't scared of getting their hands dirty. Like, I have talked to multiple of them that are at the homeless encampments, that are having conversations with individuals who are in the throes of mental health crises, drug addiction, families that are really in need. And I think we hear from a lot of folks at the legislature, but especially when I see people who aren't afraid to like get in there and be a part of those communities and really like learn and hear from them, that's what inspires me and makes me feel comfortable moving forward with this amount of money, which I know is a big ask. But it's because I think we're really doing the work to get it done. They are really doing the work. I'm just asking for money. Okay, thank you.
Thank you so much, Representative Hollins and Commissioner and Ms. Roth. With that, I renew my motion that House File 1686 be re-referred to Children and Families Committee. All those in favor, please say aye.
Aye.
Opposed? See none, the motion prevails. You're on your way to Children's and Families Committee.